it's Danny, and ever since I started posting my experience on my breast augmentation on YouTube, I have been flooded with a ton of questions, especially regarding like surgeons, how to find a good one, and consultation questions and all that stuff. And since consultation is by far the most important thing that leads up to your new rack, I thought, why not dedicate an entire video on the subject. So I hope that this helps. This is an informational video. It is not a breast augmentation update, but I hope this helps and answers a lot of your questions. I'm sorry if I do not get back to you, because I do get flooded with a lot of them, so hopefully this can answer some of your questions. Alright. First of all, let me mention that breast augmentation is a really big deal. Essentially, you are altering a part of your body, and you probably want a really good end result because of that. You're paying a lot of money, and it's not something you should just be jumping into. What most women don't understand is that choosing breast augmentation is the first step, and there's a lot of detailed choices along the way, which I'm going to mention throughout the video. So it's better to educate yourself, because if you don't educate yourself and you go in blind, pretty much you could be taken advantage of. It could end in you having a really bad surgeon, and which results technically in a really bad boob job. So yeah. So get your paper and pen ready. Don't think it's weird to bring in like I guess like a question checklist for your surgeon. It's not weird at all. You're paying a lot of money, so ask them as many damn questions as you want. Alright, so what exactly should you talk about with your surgeon? Obviously, the most important question of all of them is, what size are you going to go? Now, when you're talking with your surgeon about size, you gotta go by cc's, not cup sizes. And this is where a lot of girls go wrong, because they'll go in saying, oh, I want a D, double D, Z, I don't know. But, you know, honestly, the surgeon's kind of confused by that, because they technically don't know what you're going to come out as. They can give you around the size that you want, but they can't, you know, it's not always bang on. So it's not a guaranteed thing when it comes to that. You know, educate yourself on cc's so that you can have an idea of what to do, how big to go. You can discuss with your surgeon, say if you want to go a more natural route, how many cc's would look good on you naturally, and I guess have a good breast tissue to implant ratio to give you that natural look and feel. Now, if you want to go a little bit more unnatural and have the bigger fake look, make sure you discuss with your surgeon the biggest you can go without it hurting yourself, like hurting your health, I guess, because you know, there is a certain extent where it will damage your health, it will deform your breasts, and it could never go back. So make sure you discuss with them that. Now, some surgeons will do whatever you want, and they'll take your money, and they'll make you go as big as you want, but, you know, that's a red flag, I guess you could say, a red flag that may not be a good surgeon, because, you know, a good surgeon should be looking out for you. If you want to go a certain size and they're telling you, you know what, that's really dangerous, it could really damage this and that, whatever, listen to them and, you know, just really pay attention, because you may think they're being mean and whatever, and you're paying all this money, but really they're looking out for you, and listen to them. They're the professional, not you. They've been doing this for so long, and they've gone to the school for 9 million years for this, so just listen to them. One way to, I guess, get an idea of how many cc's you want to go is by doing something called the rice test. All you need pretty much is, I guess, some rice and some old stockings you can cut up or whatever. If you go to Google, you can like go on there and you can figure out all the measurements and all that stuff. But yeah, this is an example of what it can look like. This is a really small one. It was actually one of mine. I just had it floating around in my underwear drawer, so I thought I'd hang it out and show you. But that's what it looks like. And it's better if you have a sports bra to put them in, because it gives you a better idea of how they'll look without a bra on. So, yeah. Another question you might want to have on your checklist is the big one, saline or silicone. Ask about the pros and cons of both, and for myself, I am silicone. I chose silicone, and I'm very happy with them. However, they are more expensive than saline, so maybe saline would be the right one for you. And also, additionally, you could also research it yourself about the two, and get other girls' opinions in forums or whatever. Another question you could ask is about shape and texture. There is a round implant, and then there is something called a teardrop shape. Like the name, it's a teardrop, so it's kind of like that. The one problem I've heard about with teardrop is that if the implant shifts, because the shape isn't consistent, I guess it's not the same on all angles, you can actually notice it. You can kind of notice when it shifts, but that's rare, and you can ask your surgeon about that. Whereas the round implants, they can kind of go anywhere and they'll still look the same. As for the texture, there is the smooth, and then there is, I guess it's more, there's little bumps, it's a little bit more rougher. I'm not too educated on that. I have the smooth ones. I'm not too sure. If you're interested in that, just ask your surgeon, and they'll answer your question. One question that I think is extremely important, and a lot of girls don't discuss this with their surgeon, is profile. What profile should you get? There's different types of profiles. There's high profile, medium plus, low, and all depending on the look that you want to achieve, whether it be fake or natural looking. I guess profile has a big effect on that. For myself, I have a medium profile, but medium profile is less projection, more width. So less this way, more this way. So you get a more fuller look to the front of them, whereas high profile is more projection, less width. Now, don't get confused with high profile being like porn star boobs, because high profiles can look really good, so don't be scared of high profile implants. There is also the question of placement, which it can be below the muscle or above the muscle. This depends pretty much on frame or how much natural breast tissue that you have. So just discuss with your surgeon and see which one's right for you. Another really important thing to discuss with your surgeon is incision placement. This is complete preference to you, really. There is the breast crease incision, the nipple incision, or areola incision. There's the armpit incision, and there's also something that I saw about belly button, through the belly button. I don't know, that seems a little bit odd to me, but if you're interested, Google it or something. I don't know. Ask your surgeon. But you do have to keep in mind, too, that depending on the type of implant that you get, it could affect on where you could put it, because saline implants are filled during your surgery, whereas silicone implants come pre-filled, so it might be harder to get through certain areas. So keep that in mind, and also recovery too, because some are a little bit more of a rough recovery than others. The breast crease incision is the easiest recovery, so I've been through it, that's what I had, and I don't know, recovery was pretty easy peasy. Another question you can ask, and it's pure preference, whether your surgery is going to take place in either a clinic or hospital atmosphere. I don't know if you have a preference, but it's always good to know. Also, I would ask if to see maybe some past patients' photos. Maybe ask if you could try some sizers, actually touch and feel an implant too. I don't know, throw them in your bra, strut around, get an idea. Have a feel, give your boyfriend a feel, I don't know, just something to throw out there, something fun to do as well. Price quote is also a big factor in everything, obviously, so ask your surgeon a price quote, and ask for it on paper, and so if there's maybe something you could sign with an expiry date on it, so that, you don't leave and then come back and all of a sudden the price is up a couple $100s more. It's always good to have that. Also discuss payment options. Not everybody has like a thick $6,000 on hand, so medical loans is usually the way to go. Now with a medical loan, it's usually a monthly payments between 6 months and 5 years, whatever payment plan you want to make. Now, when you do have a medical loan, it is required that you do supply your income information and everything. If you do not have the information that they require, then you can always get a guarantor to sign for you. Now, I know that you don't want to hear about the whole complication aspect to breast augmentation, but it's really important to ask about it because, you know, maybe the risks are rare, but it's always good to know, and also it's good to know how to prevent things like capsular contraction, I don't even know how to say that word, but it's something along those lines, and I found out that you could prevent that through massage. So just ask about that, and also ask about upkeep. Yes, upkeeping of the breasts. Ask about that. You know, just future appointments, if they're going to be yearly appointments. You know, with the new silicone implants, it's really hard to detect a leak on your own, so how do you go about that, and etc., etc. Now that I've given you pretty much all the questions that you could possibly ask at a consultation in order for you to get a successful breast augmentation, I think it's about time that Danny gives it a little bit of advice to the ladies. Okay, first of all, whatever size it is that you want to go an itsy bit bigger. Just because, you know, when it comes to breast implants, especially underneath the muscle, it does compress a little bit, and, you know, every girl goes through the whole, oh, I wish I went bigger, so just go that little tiny bit more, you won't regret it. Whatever you do, do not choose the first surgeon you see. Seek a couple of consultations just so that you can compare prices and surgeons and see who you're comfortable with. Also, make sure that the surgeon is qualified. That's really, really, really important. Whatever you do during your consultation, do not at any point tell the surgeon what you are expecting to pay for the procedure. Let them tell you with their price quote, because by doing that you can be taken advantage of. Make sure you ask about any additional fees too, like for example, if there's an additional fee for a medical bra, or ask about the prescriptions that you're going to need if you're not covered. I can't stress this enough too, make sure you listen to everything your surgeon says and do it. You don't want to ruin a good thing, especially a good thing that costs like $6,000. So yeah, just listen to your freaking surgeon. One thing I've heard a lot too is girls messaging me who have just gotten their breasts done and they're freaked about how they look or they're not big enough. You have to remember that it takes almost a full year for you to see the full results. At first they're going to be high on your chest and they're going to look weird, and you know, they're going to even probably look small to you, but time is key and you have to go into this with a lot of patience, because until they drop, you won't really see the potential. Last but not least, make sure that this decision is completely yours and you're not doing this for anyone else, because that's a lot to be doing for someone else's pleasure. And, you know, you don't want to have any regrets in life. So to everyone that's been watching my videos, I hope that this helps with your consultation. And also to all the girls that have had the surgery, congratulations. And to all the girls that are going to be having it done soon, I wish you all the best. Bye.